let me get this ball rolling.
Yeah.
Corey, I got to first thing I got to do is I got to talk about my smoothie today. Smoothie today is nothing special. Whoops, sorry about that. Nothing special. It's 3 raw eggs, orange juice. Let's see, little bit of yogurt, not much because I'm trying to get away from dairy, and some the usual pineapple and strawberries.
Does it cover up the raw eggs?
Oh yeah, that's good.
Good. Just making
raw
sure.
Eggs, put hair on your chest, so try that.
Yeah,
I've got no comment for that. We can move on.
Sure, Joanne will appreciate it.
Yeah, the hair. Mm-hmm.
Yeah. So I'm supposed to be professional at this, right? Well, it's not working too good. So anyway, welcome to Smoothies with Rufus. Today do what?
Oh, sorry. I was just gonna say couldn't be in a better place.
Well, that's true. Thank you.
Smoothies with Rufus.
Today we have a special guest, not just doctor, but Dr. Sarah, which I am just super impressed with because I don't know anybody else that has 2 doctors. So whatever she says, I listen. And no, she and I have had some great talks over the years. Have a lot of fun together. And she makes me a good dancer. All I got to do is follow her. So we dance around the dance floor a little bit together. And so things like that. So Sarah, tell us, I'm even confused on what you're doing now. You're doing so much stuff. So tell me a little bit about what you're doing.
Yeah. Okay. So let's see. So right now, I treat. I'm a clinician. I treat at a clinic. I do some side work here and there, but I see about everything. So I see athletes. I see a lot of women's health, and so that's like the pelvic floor, the rectus abdominis, all that kind of stuff, all those injuries, post babies and pre babies, and then I also see this has been this is the new one, and you'll actually be interested in this one. I've been treating pediatric constipation, which never in my wildest dreams did I think I'd be here, but it's been really interesting. When it comes to like child development and movement. So we can talk a little bit about that. Oh yeah. Oh, it'll knock your socks off. It's really interesting. Oh yeah. It's not just pooping and peeing. And then let's see. Yeah, I do some side stuff. Like in some of the gyms, and that's pretty fun. It just keeps things interesting, and that's the big stuff, I guess. Wow. Just treating right now.
That's awesome. I guess I should. I'm gonna let you mention this because you can explain it better than I can. But what are your doctorates in?
I have a PhD in neurobiology, and so my specialty, my dissertation was on Alzheimer's disease and cognitive impairment. And then my and then I have my doctor of physical therapy.
Wow.
Yeah.
Do those overlap any?
Tons. Oh yeah. It's been, oh, absolutely. There's not a day that goes by that I don't use my neuro degree to treat my patients, whether it's explaining something and trying to give them, it's one of those things, like the more you know, the easier you can explain, like the more you can take it to someone else's level. So I use it every day to help people understand what they're dealing with and helping them understand like the broad system. Like it's not just their muscles, helping them kind of have confidence and moving again and all that good stuff. Let's see. It overlaps in that. It overlaps in anytime I'm learning a new skill. It all comes down to the brain, and the more you know about the brain, the more you understand about the system, the system as a whole. So
I'm gonna ask one question. I'm gonna give you the rest of the time. Take as long as you want, because I ain't got nothing else to do today.
Oh, great.
And just let you explain that. But no, we're gonna get to all that stuff. So that's great. Sarah, as we were just talking before we started recording this, has absolutely 2 of the dirtiest kids in America. And I say that complimentary as a good thing. And tell us, start talking to us a little bit about that, because you and I had talks about development, things like that, and start telling us about why that's a good thing, and
right.
What's your reasoning behind that?
Well, one of them, I mean, it's just exposure. It's exposure to, when they're in the dirt, when they're not in super sterile environments, just like anything else, they like their immune systems thrive. But then also, like, when you think about developing like sensory skills and not being so fearful of anything that you come into contact with, you need to have your hands in different kinds of sensory different kinds of sensory textures. So when you're in the mud, your hands are dirty, right? And you're feeling that kind of the muddy sliminess, which is super good. You want your kid, when you feel the concrete, when you feel the rocks beneath your feet, and learn how to walk on rocks, right? That's a skill. And imagine how that skill then goes forward to, first of all, that a little rocks don't bug you, right? That you can put away the things around you and stay focused on what's important. If you can't adapt well to different senses, then you're always being, your brain essentially is always being interrupted by the world around you, which isn't necessarily helpful, right? Like a life skill. So having your kids walk on gravel, walk in the grass, don't worry about sending them outside with their shoes on. When we go camping, the kids are constant. I mean, they don't wear their shoes. They might even complain. It's like, oh, my feet hurt. And you'll even say like, well, you can go put your shoes on if you want. They're like, oh, that takes too much time, and they're walking over like roots in the ground. So imagine like when you're looking at building, like, it's not just, you're building physical skills, right? And we always talk about that, like movement patterns and just general athletic movement. I guess I don't even want to say athletic, but like movement competence. But then you can see how those skills can actually affect them and help them academically. So when you're learning, you have to really figure out how to put away the noise. And if you're always like extra sensorial, if you're not used to having a lot of different sensations that that you've been exposed to, then a lot of things like essentially take your attention away, which is it's a barrier to learning. So it's not just about movement, it's about the whole life process. And then how you deal with adversity, right? When you come to something, you're like, oh, that hurt, like I still want to go and do this other thing, but it hurts to walk over these rocks. Well, what are you going to do about it? And so how are you going to overcome these challenges? And I think the physical environment, the outside environment, helps kids at a very early age learn how to start dealing with barriers, overcoming adversity, starting to adapt to different senses, and know how to focus, what to focus on, and what are extra things that they can start putting out of their minds to stay focused on the goal at hand.
Wow. So, I never thought of that.
Yeah, lots of fun stuff.
Jeez. I know Corey's got a question. Go ahead.
Yeah, Sarah, is that something you apply in terms of your physical therapy practice too? Especially on the pelvic floor side of things, where I'm sure more so than maybe other musculoskeletal injuries, people are going to have different sensations more internally than externally that they're going to have to kind of wade through and try to understand. So that's something you're talking to your patients about as well?
That's an awesome question. And absolutely. The pelvic floor is super, it's super innervated by the autonomic nervous system. So you're going to get your fight or flight, rest and digest. It's like, it's the unconscious emotional, it has a huge unconscious emotional component. And so when you're talking about the pelvic floor, you have to understand that, and so that you can't be straightforward with people about it, because you can actually turn them off, like, well, you're gonna have to get used to, just get used to it. But if you kind of talk them through and help them understand that that something's going to be uncomfortable, and that's okay, and let's make uncomfortable but still tolerable. So I talk a lot about that it's okay to have some discomfort, but if you're having so much discomfort that your sympathetic nervous system is being overridden, and of course I try not to use those words. I usually have especially pelvic floor, if it's a pretty complex patient, or even a moderately complex patient, we'll start from the bottom. Like, what's the, I'll give them examples of how the pelvic floor is kind of can be ruled by the sympathetic nervous system. And so how we want to deal with that. And that you want to have some stimulus, but not so much that their brain is unconsciously shutting down. So what I'll tell them, and that's so important, the unconscious, because a lot of them feel like they can do they really want to be able to overcome. And, it's that, like, if I just push harder, if I just do more, then, I can overcome this. I can overcome this pain. Instead, I help them step back and say, well, some of that's not in your control right now. And I feel like it gives them a little bit of a breather, trying to always be a fighter, which, again, being a fighter is sympathetic, right? So I talk a lot about, being the person. My favorite thing to say is, like, be the person you hate to walk with. Because usually a lot of people with a lot of high pelvic tone are type A, they're going. And so I'll be like, as soon as I say that, they laugh, because they know there's always that person that is a saunter. They're looking around. They, doesn't have that goal. I'm going to get there. And they love it because it gives them permission to stop and to settle down and to feel their heels. So that's always a cue, be in your heels. Don't walk on the front of your foot, and relax, be a saunterer. And I'll give them that for homework. A lot of times you don't go straight for the pelvic floor. You do that kind of stuff and give them permission first to relax, and figuring out how to do that without saying relax. Does that kind of answer it?
Yeah, absolutely. I'm just curious how you build that into your interventions as well.
Yeah. So when I start, I almost assume, and of course I check, but anyone who comes in to see me for almost anything, I almost assume that they have holding patterns, that they're guarding, and that they're not. It's very rare that I see people that are totally yielded and they just need work, like with strength or muscle tone. They exist, absolutely. But usually I find people that have strong holding patterns through their pelvic floor that I have to help them release first. So I always start with figuring out a position that they can actually start to feel their pelvic floor relax. I don't use biofeedback, because it's such a sterile environment, as you can imagine, I don't really like, where they're looking at a screen to decide if their pelvic floor is relaxed instead of feeling their pelvic floor, right? So I try to position them in a way that I know that they're going to be successful. So whether it's just knees to chest, like a happy baby position, a really supported child's pose. So I try to get them to yield first, always, and to feel what it is to relax and to chill their system out. And so depending on the person and the situation, if I do need them to walk, that's like, I'm cueing walking, just, I want you to walk 5 or 10 minutes a day. I want you to saunter, look around, smell the roses, act like you're walking with a 3-year-old. If that's a good analogy for them. You always pick the analogy based on the person, right? And so I try to find some way for them to understand that I need them to chill out, relax, and stop walking with purpose.
I like that.
Good.
Can you also explain why having such a like hypertonic or overcoming strategy at the pelvic floor may not be advantageous, just in terms of like living daily life, doing activities?
Well, first one, let's just start out with like regular body things, constipation. I know. And we don't want to talk about it. No one talks about it, but if your pelvic floor is hypertonic, you can't poop. And imagine, so then let's take it through like all the stuff. Let's go full on intensive, right? So you can't poop. So then all of a sudden you actually have a pressure problem, right? That is just living inside of you. So then now you have to, so you're holding it, you've got all of this extra weight inside your system that doesn't have like, so, when we talk about like having the pelvic floor as like a trampoline to actually bounce your stuff off of, your internal organs. Well, now, you have another essentially a solid organ in there. Of course, poop's not an organ, but if it's filling your colon, it will present as a solid space, right? And so you're not going to have that good bounce. So you can also think of how it's now going to change your position. So people who are full of gas or bowel will start to quickly compensate. So little kids who, and this is what I was saying with like really seeing a lot of this stuff in little kids who are constipated. So all of a sudden you see these patterns. So you'll see, and of course it depends on their build, which we know, like the narrow wide stuff. So they'll start either like really narrow little kids will start going into a quick anterior pelvic tilt, and you'll see it really quick. And then their little narrow bellies like stick out. Well, it's interesting because then when you see someone who has a little kid who has a naturally more wide angle, what I see with them is they get really compressed, and they actually show they'll have a diastasis because they're moving outward. It's really, really interesting. And they usually have a shorter, so like the narrow kids usually have they have a little bit more space. And so, like I said, they'll just protrude out and over and tilt back, and their bellies will, I don't know, it's really interesting. But the wide angle kids will get broad and really flat, like really, really narrow A to P. And you'll see little diastases. So little baby or like little kid diastases. So it's really, really interesting how this stuff starts presenting. So you can see like the model really quickly because you're having such a pressure management problem really early. And so you start to see everything like unfold. So yeah.
That's really cool.
Yeah, it's cool to watch. Absolutely. I mean, it's not cool for them, but it's definitely interesting to see things happen so early and so quick because of something like, an extra thing that they have to manage within their guts and how that affects the pelvic floor. So, okay. So constipation's one way or one thing that affects daily life. Of course, like, let's just go there. Sex. For both men and women, their pelvic floor can affect how sex feels or how you can't feel it, so those are things that play right directly into the pelvic floor. But then, now we can go into athletic development, squatting, right? If someone has a hypertonic pelvic floor, they're not going to be able to get onto their heels. They're going to dump the bar forward. So we're going to see a lot of that. So you have to, then if those are the goals, then a lot of times what I do, I guess, if it's sports and I don't feel like they want to go there, I just coach it. And of course I wouldn't directly treat the pelvic floor, but I coach the problem. And, we don't even have to say the word pelvic floor. They don't have to know what I'm doing as long as I'm fixing it, right? But you have so I'll see a lot of women who will actually have a hypertonic pelvic floor with lifting because they've been doing some inappropriate lifts. Well, then they may start to show, and actually men too, they'll start to show pelvic floor problems. And then so we have to take their lifting and retrain how they're lifting and their lifting patterns and the choices, their lifting choices, which can be tough, especially for like a 25-year-old woman who got into lifting. She's really excited. She's excited about getting strong. And then all of a sudden I'm the person who has to say, okay, let's step back. So, and like, oh, I love lifting. Don't worry. I'm not trying to take that away from you, but we need to step back and figure out a new strategy for you. So those are lots of conversations that I've had over the years.
This is a very different conversation than we typically have on here.
Yes.
No, this is pretty cool. I mean, I don't understand all the words. I'm probably the only guy listening to this podcast who doesn't understand all these words. So how do you know that you have a problem other than going forward? How do you know you have a problem with the pelvic floor?
Well, I mean, you can think of like the obvious, the pee, poop, sex, but like, so sometimes women will have, like, they'll get recurring bladder infections, and that a lot of times is a pelvic floor problem. Leaking urine, not being able to pee,
Really?
Oh yeah, that's a big one. That's a problem for sure. Having let's see, like I said, constipation. And sometimes it's interesting, constipation will present as, like in little kids, it'll present as like actually leaking stool. So little kids who like keep pooping their pants and their parents are like, what's wrong with you? You're 8. Why are you doing this? It actually is an issue with their pelvic floor and constipation. They long story. They can't feel themselves leaking poop. So that's for another podcast. But
we can do that
these are
too.
things.
Podcast.
Yeah. The poop podcast.
Yeah.
So if, and it's actually good, any coaches that are working with kids, it's not the worst thing to know about, because like if a parent mentions it, or if you're noticing that it's happening with a little kid, either like leaking urine or leaking bowel or any of the, or like bellies that always hurt, it's a good reason to say, hey, maybe this kid should be in PT for some of this. And then so those, I forgot even the question at this point. I got lost in pee and poop. So oh yeah. So those are ways you might know.
That's why I love you.
I got nothing. I'm not looking to impress. I'm just doing smoothies. Let's see. So other ways you might know you have a problem. Well, I mean, like, then it goes into like the subtle stuff, like squat, like issues like with squat depth. I mean, you could have a knee problem and it could be related to your pelvic floor, but when it comes to like real big major pelvic floor problems, it's usually directly kind of a pee, poop, sex problem, or pain, or like coccyx pain. That can be pelvic floor. Just people with a lot of pain in their pelvic floor, men and women. It's crazy. And so yeah.
So how, as a coach who doesn't have your experience, how do you work on that, or how do you fix it?
Right.
I guess I'm looking for, not every kid's going to poop in the training hall. Now I've had them do that.
Right. But, yeah.
How do you, so I look at it as they can't control the speed of going down into the squat.
Right.
Okay. Like they'll get to a certain point and then just drop.
Mm-hmm. Mm-hmm.
Okay. So, I mean, that's kind of the reference that I have of it.
Right.
So how do you address that, or how do you fix it, or
Right.
whatever?
So
Or am I totally off track?
yeah, no. That's actually a perfect question, because so one of the things that's really important with kids who have all this stuff is retained reflexes. So sometimes, and I have a really, really interesting story about that. So I'm going to try to get to it. But so when kids have retained reflexes, they're being controlled by their reflex system instead of having more of their own control over something. So some of the best stuff that is good for helping retained reflexes is, you're going to love this: crawling, crab walks, crossing midline, all of those types of drills that you guys do already. So if you have a kid who's dropping, like belly work, being on their bellies, like army crawls and stuff like that, to start seeing if there's a movement problem that's going on. So of course, with anything, it's like you have to drop it back and help them control it, whether it's taking kind of taking them back to their like to a baby body weight, you know what I mean? So taking the load off, or supporting the load a little bit, so that they can feel themselves figuring out how to manage their system going down. So I mean, if they're constipated, it's going to be hard. That they need to poop, and so at that point, you're probably going to do some almost you're going to do a lot of flexion work in resting. So these are the kids that might need like some kind of the knees to chest breathing stuff, or the child's pose breathing, to start relaxing their system a little bit better, and in order to allow them to poop, so then they can squat later, or they can squat without all that pressure on their systems. There's tons of directions to go with it, but there's a lot of, with kids especially, there's a lot of like crossing off, well, I guess adults too, like crossing off different things. And so making sure that they have all the basics down first, and then load them well, and not too quickly, even if they look like they can manage it. Like you see that big kid walk in and you're like, you can do this, you're a big kid, you got broad shoulders. But if how they look isn't in line with their size, then you have to take it back, and you have to figure out, what else does this kid need? What foundational movements are really are falling behind here? So
like almost every day we do bear crawls, or just crawling on their hands and knees, army crawls, those kinds of things. And we started doing like knees to chest, just rocking back and forth.
And
stuff. So we're on the right track doing that kind of thing.
Yeah. And actually, do you end with some of it?
You mean end the workout?
Mm-hmm.
No, I never thought of that.
Yeah, because they'll get hypertonic with the workout just naturally. And if they have a hard time like coming down from that, it'll help their bodies relax a little bit after the workout, to help especially some of the rocking, breathe, the breathing stuff, not major breathing stuff, just being in a relaxed position, or some of that, just rocking back and forth, can help bring them out of some of those extended postures, to help them.
So what's the breathing pattern then? If I'm rocking, is it exhaling when I go back, or inhaling going back, and exhaling coming forward?
Yeah, you want to inhale on the way back, exhale on the way forwards. But really, I don't want, towards the end of the workout, I think I wouldn't even want them doing that as much as more static stuff. Like I said, like knees to chest, happy baby, child's pose, just some real relaxation things where they're just breathing. Yeah, I mean, that's how I would end them. Just like chill them out. Their parents will probably help you too. It'd probably help their parents too, because it'll help them come down a little faster.
Right.
So they're not so amped up from lifting.
I didn't think of that. That's a good point.
Yeah. So do you have any kids that when you're doing the like the bear crawls and stuff that just can't do it right?
Yeah.
It just struggles no matter what.
Oh yeah. Yeah. I can't wait to hear the answer for this.
Yeah. Yeah. No, it's probably a reflex kid, a kid who still has retained reflexes. And so you got to find a way.
Do you mind just explaining what retained reflexes are in case people don't know what that means?
Yeah. So we're born with a reflex system that helps us be able to unconsciously interact with our environment, right? And those are survival things, like something's towards a baby's face and they go towards it, right? When they're touched, to be able to start eating, so they understand that. So it's a survival thing. If a baby didn't have these, then it would die because it wouldn't have any desire to eat, right? Or know how to respond in order to get food. There's the typical that fencer's reflex or ATNR reflex. So if a loud noise goes, if they hear something, their face goes and their arm will go out naturally to start like interacting with your environment, right? And these are all great, but if a child retains these, there's some protective reflex, like the extension reflex and stuff like that. If a child retains these, then they're not really in control of their movements aren't totally separate from each other. So like their head movement is no longer separate from their arm movement. And so it can affect sports, right? These kids have a hard time. They might have a hard time seeing across the field, or being able to cross their foot over their body, or all that stuff. But it can also affect reading. So these are kids who can't focus on their if their eyes are over here, it's really tough for them to figure out what they're reading. They might be able to read the words, but it's so difficult that they're not retaining it. It's exhausting. So a lot of times, like if they're trying to cross their midline and they can't stay supported on the opposite elbow, let's say they're on their belly and they have one arm underneath them and they have to cross their right arm over their body, and their left arm collapses because they can't actually make the crossover. So they just lean their whole body over. Well, that's not very functional. And so, because these movements are not functional, like I said, it's exhausting for them. And so being able to do another task at the same time is almost a no-go. So sometimes these are your kids who, you put them in a sport and they're off in la la land in the field because it's too much effort to listen and be able to do a skill at the same time. Right. So they're just done. It's too much. And so a lot of times we see these behaviors and we think, oh, my kid doesn't like sports, or they're not trying. They're playing around. They're goofing off. And this isn't the case. They really can't. And so if the activity isn't regressed to their level, they're always going to present like this. So, it's the class clown, but he's just trying to take the focus off of himself of not being able to do the activity. So, these are kids who I feel like these kids are the ones that we really need to be looking at we're always so worried about the kid whose parents have them in 20 different sports. Yes, that's a problem. Or has them, in sports year round. Yes, absolutely. Overuse injuries are a total problem. I get it. But I think we're missing this group of kids who could have like a competence, an athletic competence, not NCAA athlete. I'm just talking about athletic competence, but no one's watching that they're not able to do that activity, that it's too tough. And how can we regress that activity to make it doable for them? So the person I was going to mention that I think is such a huge story about this kid, he's 13, right away. So mom comes in, and parents are awesome. He's stocky, but not obese by any means, right? And you can tell he just hit a growth spurt. Mom comes in a shirt that's like very much like her kid's on an all-star baseball team. I find interesting. This is clearly not that kid, right? And so we start talking. He's in there for constipation, and so we start working on that and figuring all that out. But when I start to try to give him the basic stuff that I give these kids, and I start to watch him move, he's the most uncoordinated kid I've ever seen. And he apparently loves sports, but he's like, his brother's really good at sports and he's not. And so I realized, okay, that's the baseball kid. And the mom's like, I forgot, like I'd said, did he have any PT before or OT before? Just trying to get an idea of, has anyone caught this before? And he's like, she said, oh yeah, he had something. It was like, oh, he walked on his heel. Like I forgot. I can't even remember what she said. Like, I think he only had a heel strike. I don't know what was going on. And he's like, so we went to PT. They gave us I know it wasn't a toe walking situation, because that would have been too easy. It was like he was like just landing on his heels. And she's like, oh yeah, they gave us some stretches and then sent us on our way. And I'm like, oh my gosh. So I have a really good peds PT that I consult with some of this stuff. And she came in and we checked sorry. First, his dad took him to an appointment, and I was trying to have him do some stuff, and his dad was seriously like he was like getting flustered. And finally I had to like sit to tell the dad, I was like, he can't do this. And I talked about retained reflexes, and his dad started crying. He's like, I never wanted my kid to be the best at the sports, but every time I try to coach him, he can't do it. And I've talked to doctors about it, and they think that, he's like, I don't want him to be a professional athlete. I just want him, I feel like he should be able to play some sports, and he felt like people thought that he was asking too much. Like he's just not a sports kid, And so we got to talking about it, and talking about how this kid is low tone, he doesn't really have control over his limbs. He's really being ruled by his reflexes. And we have to fix this. And the dad was just so like, finally someone was listening to him, and finally someone wasn't, pushing him off as, that he was trying to turn his kid into something he's not. The kid as well was just, finally like someone was on his side too, where he's like, yeah, dad, like, when he's asking him to do, no, put your elbow up, like wide stance, all this stuff. The kid was like, yeah, I try to do what you asked me to do. It doesn't seem to ever look right for you. And so it was this rift between the dad and the son, that was developing because of something that was just not being addressed. And so we went back. I actually sent him, because he needed a gym that really, like a peds PT place that could really support his needs a little bit more. But yeah, he started to be able to, like, we got him orthotics for his feet. We started doing all this other stuff. And we got him over there to work on some of this stuff. And now he's feeling better. He's pooping. And he's
Of course
I had to work it in. And he's now playing the sports that he wants to play. His goal, it was so funny. His goal was to be able to like tackle his little brother, who thought he was really annoying. And, so he had those physical goals. They weren't just his dad's, but he didn't have the physical ability to do them. So very long story short, saying reflexes are really important. And when we start seeing kids who can't do things, we can't write them off as not interested in sports. We have to give all kids some level of athletic development. They don't have to love sports. They don't have to love team sports, but people need to move. And that starts as kids. And so where can we meet them and be able to give them skills that they're like, be able to give them things to practice that they're actually capable of, so they can take it on into their lives.
So would that be a case for why gymnastics is so good? Because of all the different, because of all the different movements and things.
Oh yeah. If you have,
so do you go ahead. I'm sorry. Go ahead.
Oh no, I agree. As long as, again, you have a coach that can, you can have a coach that can regress activities. That's always the biggest thing. And I mean, like, that's the difference between, a decent coach and a really good one is not progression. It's regression. How can I make this person be able to do what I need them to do, accurately and safely, to be able to build up from there. Otherwise, they're going to continue to compensate and use compensation patterns to progress, or they're going to quit.
Getting flashbacks to like when I played t-ball, you had like all the kids in the infield would be like very into the game, and you'd have like the outfielders where the ball like never got hit to them. They're just like literally sitting in the grass, like legs crossed, just like picking flowers out.
Right.
Dirt. And I'm wondering, like, same kind of thing where it's like, are these kids who just weren't interested, or was there like something else potentially going on?
Exactly. Well, and what could have happened if someone would have brought them into the infield, maybe not to be the infielder, and started to give them activities that were more appropriate for them at the time. Like playing with, like, instead of like a glove and a hard ball, like one of those like little sticky Velcro mitts. See what I mean? Addressing some of these crossover patterns. And a coach might not be able to do that, but he or she might be able to say, hey, I see this happening, maybe we need some PT or OT.
And when you do these crossing patterns, what happens in the brain? I know something happens. I can't tell you or explain it, but I know something good happens.
Yeah, absolutely. So, well, of course, like, there's the whole process of learning, right? And that's very cellular. You start like, so we'll do a quick learning, what learning is, I guess. So as you start to be able to get, as an area of your brain gets more input, these neurons, like they start firing. And when neurons fire more, they actually start to build a more elaborate structures, and start connecting to more things, right? And so when you're building movement patterns, there's lots of places in your brain that are involved. But you start to connect a little bit first. So those neurons, like, if it starts out really small and isn't firing much, it's not doing much in the system, but the more that neuron gets activated, the more the brain feeds it, right? And the more it builds itself. And then it connects to other neurons, and it creates like a very complex web of connection. So that's why with sports, we play different sports to build that athletic connection, so that when something happens, then you have crossover with sports, right? And that's really cool when basketball makes you better at soccer, because you've done something in basketball, and you have such a complex web of movement patterns that you carry over into a very a different environment. So that's real learning, right? So, and that happens not just with movement, it happens with information. The more you know information, the more you can take it from one, from just like, getting the answers on the test right to figuring out how to use this information in your daily life, right? So the more you move, the better you move, the more connections you make, and the more you can use those skills in all parts of your life. So there's that part of it. When you're saying what happens when, so yeah, that pretty much answers it, right?
Yeah.
Kind of.
Yeah, no,
Okay.
it's fine.
Okay. Yeah. So, but you have to have that integrated movement. So otherwise you just can't do as much. And you just, that's why not having the reflexive movement is really like the reflexes, not reflexive movement. That's different. But when you have those integrated movement patterns that are still reflexive, you're not actually activating those good neural patterns in like up here to start making good connections to have more complex movement for sports and other activities.
Okay. I can see the wheels turning in Corey's head. Go ahead,
Yeah.
Corey.
Well, anything else you want to add to this, Rufus? Because I want to switch gears a little bit.
Yeah, of course you do. No, I've got a whole podcast I could talk about this. Go ahead, switch the gears. We're gonna have to have her back
Switch
on.
it.
So.
Well, I want to talk about incontinence a little bit because I think it's something that gets mentioned in physical therapy school, and it's kind of talked about very superficially in terms of like, oh, like maybe it's like an intra-abdominal pressure issue, or there's like some pelvic floor weakness. So I'm kind of curious your thoughts in terms of, well, one, what could cause incontinence, and then does the threshold at which the pressure intensity buildup occurs basically, or like what's the threshold for how much pressure someone can take before they may like leak or something? Like how does that play into how you're going to approach treating someone with incontinence?
Well, first I have to figure out why they have incontinence. So, okay. So, someone can have incontinence because they have a weak pelvic floor. And so that's what you're talking about, the pressure buildup. So the amount of pressure you'll be able to manage is all based on the strength of the system, that like pressure system. So your pelvic floor, your abdominal wall, your diaphragm. So, when you have a really strong core system of the and that's lined up well. So, you can have you can power lift like a female, and understand like a female's pelvic floor is so like the hole that has to be covered by muscles is so much bigger, right? So that's why it's such a female issue usually. But if you have a power lifter that has or an Olympic lifter that has a really solid, strong pelvic floor, fairly lined up diaphragm over your pelvic floor, because those things work together, and I can explain that more if you want. And then a strong abdominal wall, well, they can handle all sorts of weight and push their belly out with a belt on, adding more pressure to the system, and be fine and not leak. Let's just say you're 65, you've had 4 kids, and your organs are fallen down. So your uterus is no longer suspended anymore by ligaments. It's lying down on your pelvic floor. So that's extra weight. Maybe you're also constipated, now you have a ton of pressure on your pelvic floor, and your pelvic floor is weak. So someone like that, it's not going to take much to be able to leak urine, right? They're going to be pretty quick to leak. I've seen women that have had, maybe they just have one of those, like they have the prolapse, or they don't, let's just say they don't even have a prolapse. They, they say, oh, I leak a little bit with jumping and stuff like that. They might actually not have a pelvic floor strength problem. They have a positioning problem. And so you can strengthen the pelvic floor. And then what's going to happen is you're going to give them pelvic pain because you've had them do Kegels, and that's not what you need to have them do. So with those people, I have to work a lot on position. Okay. So that would be a different situation. There's people that post delivery, they lose a little bit of the innervation, or it's at least like damaged a little bit, and they might have actual pelvic floor weakness. So I would address that different, right? So that might be something I address with Kegels directly. So I have people that just don't know how to activate their pelvic floor. So maybe they had a baby after everything got stretched out, and they just need some cueing. So they just need me to go in there and say, oh, this is how to do it. This is how to do it properly. And then they get it, and we do pretty well. So there's so many things. And that's what I get a little irritated. I'm not gonna lie, get a little irritated of all the pelvic floor experts now that have never actually felt pelvic floor muscles and understand that there's a million problems. Some people have actual they have too much irritation around their bladder, so they feel like they have to go to the bathroom a lot. And their pelvic floors are usually kind of tight. And so you give someone like that Kegels or any kind of pelvic floor work, because you're assuming that they have a weak pelvic floor. So then that's where your training goes. And I don't care if you're doing Kegels or squats, if they have bladder irritation, then that needs to be addressed. Some people, these are the fun ones because I fix them really fast. It's like a poor brain bladder connection. And so they have these places that actually trigger their bladder. So when they're going home and they're going to let themselves in the door, their brain has started like developing a really strong connection between like going to the bathroom and going home. And so their bladder will just contract right there. And because they've never had to think about it, they don't think about contracting or changing that pattern. So these are the people that I'm like, when you go inside, you have to, and I make them do it right in the clinic. I'll say, what's an activity you can do before you go pee, before you go to the bathroom, when you get home? And they'll tell, I'll let out the dog, or I'll look through the mail, whatever. And then they come back and they're like, I can't believe that worked, but it worked. Because you're taking away that quick connection between the brain and the bladder of I'm home, I need to pee. And our brains are efficient. They're amazingly efficient. It's the reason that if you always get up and go to work at 7 a.m, you get in your car at 7 a.m, Monday through Friday, and you happen to have to get in your car on Saturday to go to work or to go somewhere at 7 a.m. If you're not on it, you're going to drive to work, right? Because our brains are efficient and they create these patterns. And so sometimes just breaking the pattern is enough to stop incontinence. So there's a bazillion answers to solving incontinence, but you have to understand the connection between the brain, the bladder, and the pelvic floor. So when you contract your pelvic floor, you automatically, there's a quick nerve connection between the pelvic floor and the bladder. So if you can properly contract your pelvic floor, you actually send a message to the bladder to relax. Okay. And then there's a connection between the brain and the bladder. And that's what I'm talking about, like those combinations that are those things, those situations that we make ourselves, that one thing equals peeing. And so then you'll just pee. If you don't have the pelvic floor in there to stop that connection, then you're going to then you have a problem. So it's very, there's so many levels to it, and you have to understand all of them. You also have to understand things that might, like food and drink irritations that affect the bladder. Also, people who aren't really careful at watching what the abdominal wall is doing. So I can feel someone Kegel. Let's just say I'm doing an internal exam and I ask someone to Kegel, and I feel that their muscles are working, and it's someone who complains about leaking. And my younger self would have said, oh, they shouldn't leak. They're strong. Their pelvic floor is strong. Why are they leaking? But then as I watch a little closer, as I've learned, as they're contracting their pelvic floor just a little bit, they're protruding their abdomen, and it's hard to catch. It's very small. And so you have to watch that. And so there'll be this tiny baby protrusion of the abdomen, which helps me. And if they're just doing that for a little pelvic floor, imagine what they're doing to lift up a box, right? Just so then I start cueing them I start working on at that point, I stop doing anything with the pelvic floor, and I start working with how they're contracting their abs for doing anything. And it fixes itself up. So there's so many things, but you have to understand the whole system. You have to understand what urination is from a neurological standpoint, from an organ standpoint, from a pressure standpoint, and from a bladder, or from a pelvic floor standpoint. And constipation causes people to have incontinence.
You worry me.
I know. Well, it's all I talk about it all day.
Wow.
So yeah, that's my 2 cents on why people shouldn't be just throwing out on the old interwebs about how, about their thoughts on treating pelvic floor. So
I'm with you on that, especially after hearing that explanation.
Yeah, right. And so, and then there's also trauma. And so I'll just, leave it at that. But that's also one of those things that's important to note.
Might be one of the first times I don't have a follow-up question on that specifically. Yes. I don't really know. We take it a million different ways, but I think for our purposes, I'm more curious, just based on just having this understanding and this experience being in the environment you've been in for the last couple years. Has this influenced how you view strength training? And has it offered you a different lens, or has it changed how you view what strength training is and what it can provide for people?
Luckily, that's a really good question. Luckily, I met Mike and Bill so long ago, before I was a PT. And so, and then was trying to train. And so I think, and had to train through, you had to figure out some big injury stuff. And I think doing that really set this concept in me that, the concept of training for wellness versus training for performance, and how important it is to sometimes think of those not only separately, but then of course how they can meet in the middle as well, and where anyone can fall into that range at any given time. So that kind of that was my foundation. But this is one of the important things I've learned, and maybe also feeds into that when I see things online about training women postpartum, that really frustrates me and makes me kind of sad about the industry, is that unless you are a professional athlete like Serena Williams, any of those pro soccer players, Alex Morgan, all those people who get back on the field and the court after babies, these people are professionals who have spent years prior to giving birth being insane athletes. And so they're already beyond all of the rest of us genetically as it is, but their muscle control is crazy, right? And so, that's always put out there as this idea of, if they can, they're doing this, they can do it. And that's what, and there's so many videos out right now of what a woman should be able to get back to after giving birth, right? How many different programs internet programs are there for diastasis, leaking? They're everywhere right now, getting back to athletics after having a baby. And what's so frustrating is most of them first of all, like that whole wellness and performance, like most of them really need to be in full wellness. I'm talking, like you're trying to manage like this new life. Your body's completely changed because bones bend, right? You have a new huge stressor. Your relationship is a stressor, and then a lot of these women are still working full time. And so then they go online and they're so stressed out and they're worried about the way they look. It's something easy to control, right? Oh, I need to get this back. And I have this big diastasis and I'm supposed to take care of that right now. And so they go and they find something online that I've never seen anything good online, because you can't see there's not someone looking at you and saying you're using your abdomen wrong. And most of them, they've gotten so stretched out that if they have this diastasis, they really have forgotten or have never had to address how they're using their abdominal muscles. So they can't do it already. And so then you put on a training system where no one's watching them, and they get worse, right? Or they stop, then they're more frustrated. Then when you're looking at, then they're getting more depressed. I can't get my body back. I can't, now it's worse. Now I'm in pain. Now my pelvic floor is in pain because they try to do activities and then they were trying to essentially use like a hypertonic postural mechanism for their pelvic floor. And so I just see people like women getting ruined when they need to be right. They need to be in so much wellness, maybe even just, some stretching and I'm not tight. I'm like more breathing, stretching, and just focusing on their insides moving again, focusing on how their body needs to breathe again. But because of the way our society has kind of put things together, they're working on, doing planks for longer. And so I see a lot of women who have kind of really ruined themselves and made their diastasis worse, made other things worse because they're working in performance. And a lot of that stuff, they don't want to say it, but it's performance. And so, yeah. Sorry about the downer. It just sucks. It sucks to watch. It sucks to, watch so much marketing and they spend so much money because they've been marketed to, and everyone realizes it's like a weakness.
So whether it's someone postpartum or someone with pelvic floor issues, or even just kind of general other things you may see, do you have specific objective measures you'd like people to achieve before you begin more upright activities or more strength-based activities?
Mm-hmm. Yeah, I tell them from the start, especially these women that are wanting to get back to, are worried about their diastasis or leaking, and they want to get back to strengthening and stuff like that. One of the first things I tell them is I say, I am a stickler, just like my rap, right? I'm a stickler for the foundations. And I'll say, I promise you, as soon as we get these foundations, as soon as we get you understanding the foundational concepts, then we're going to move, really fast. And it's true. As soon as you have certain foundational patterns down, so then you'll understand the cues, you'll know exactly what I'm talking about, and we'll get you up quickly. But what I need them to get to first is feeling their pelvic floor in yielding. So and like I said, I do everything to prop them up, to support them before I even, to make this right. So whatever they need. So sometimes, like, let's just say it's child's pose, I'll put a huge pillow between their thighs and their legs. I'll put a huge pillow between their thighs and their belly if they need it. So they feel like that they're like just like in a big pillow hug. And I'll have them start to just do the breathing in that position. And I'll give them I never want it to be a cue, because I always tell them you shouldn't have to do anything. Like, you're not doing anything, you're just feeling. Because if they're doing, it's over, right? Because they're trying to make it happen when it's a system at rest. And so the goal is to properly line up their diaphragm and their pelvic floor to naturally, so in a good rested system, naturally, as you breathe in, your diaphragm goes down, your breathing diaphragm goes down, and so does your pelvic floor diaphragm, right? And when you breathe out, they naturally come up. It's just a nice little pump system inside your body. It's good for organ motion, right? Which is, it's all the things that we need. Good for like colon motion, all this, everything, all your insides are gently moving with this rise and fall of the pelvic floor and the breathing diaphragm, right? That's a pressure system at rest. So what I have them focus on, I'll say, as you breathe in, you might feel your sit bones just expanding a little. And what that is, it's actually just the pressure of their pelvic floor yielding to moving away from them as it fills up with air. And that's what should be happening. And they'll feel it, and luckily I can see it. So it gives me the cue whether they're doing it correctly. So we'll try it. We'll try it in different positions. I'll always start out with the position I think will work for them. A lot of times I'll have to prop their pelvises up to bring them out of an anterior pelvic tilt a little bit passively, right? So that's the first things first. I need them to feel the rested motion, the yielding and the rested motion of their pelvic floor. And so that's always first things first. Second thing is then I need to teach them how to use their system, how to manage their pressure system with movement. So this is where we get into the exhale, right? And I start using the exhale where, and depending on the situation, the person, let's just say, I might do a wall reach. I might even do like a supported wall reach with their hands on something if they need that. I always regress. It might be side lying. I've had people doing it side lying. Quadruped, whatever it takes to get them to feel how when they exhale that their pelvic floor should come up. And one of the biggest things that I've kind of seen and learned over time is that we always talk about the exhale and like, whether either pursed lips or, depending on the person, but even those methods can go awry because people will try really hard and they'll start protruding their abdomen. Like I said, it's small. So that's one of the things that we work on right away is how to breathe out where your pelvic floor is going up and your abdomen is going in. Depending on the person, I might have to split those up into 2 exercises at first. Or if there's someone who can do it, we put them together. So I teach them essentially how to get their support system working in full, like posterior pelvic, in a fully supported system. Then we start progressing. So we start progressing the activities. Let's just say they've got that system. They exhale, their belly goes in, their pelvic floor comes up. It all looks good. And then what I'll do is I'll start having them exhale to get that system. And then during the exhale, so they still have to be exhaling. Let's just say if they're in quadruped, just doing a very easy shoulder flexion, right? But what I'm teaching them is how to properly support themselves pre-movement and how to continue supporting themselves during the movement. It also prevents them from using like swinging to get the movement. So it prevents all of the bad habits of using momentum to stabilize themselves, or not really stabilize themselves, just to move. And so if I have that, then then it's super easy and they understand my cueing. And then the other cool thing about that, so I had one lady And she's like, okay, we worked on all that. She's like, what can I do? Can I go to the gym? Then it's so cool because we've worked all the way up to standing. I'm like, now you can do whatever you want. You just have to keep, because she had a pretty significant diastasis and it hadn't been years. So it's not like we got all that fixed. She could control it, but then she now has her own, she is in charge of it. She knows what she's supposed to be feeling because we used all the feeling cues. So when something's done wrong, she knows that it was done wrong. So now she can go to the gym. She can, I think she wanted to do Zumba or something. I don't know. But I was like, okay, but these are the rules. Just like before, just like we worked on in here, you have to be able to, these things have to happen, and then you can do whatever you want. And so I like the idea of being able to prepare someone for whatever else they want to do, and for them to feel in their body, like you said, those internal feelings. What do you need to be feeling internally to then go out and, do orange? I don't care. Do Orange Theory. I don't care. I don't, do CrossFit, but understand that if this isn't happening, that you're going to have problems, at least in the first few years when things still haven't, like the ligaments haven't kind of gotten a little bit of that tightness or that back to them, if they ever do. So.
Well, I think you brought up a great point. You mentioned earlier too, and this was one of my big takeaways of being with Bill for a couple of months, was this idea of just, you should be letting things happen. You're very rarely trying to force. You're not trying to force a certain position. You're not trying to force expansion in a certain area. Like if the setup's right and they're relaxed, these things should just kind of happen.
Yep. And that's exactly it.
Yeah. And this is something Rufus and I talk about too. When you have like an athlete who needs to rotate or change direction, like the more they try to force things and create too much tension or too much stiffness, it's going to end up blocking their ability to rotate and turn and create force in the right direction. So I think that's something that kind of gets missed a lot, is that you're trying to force something too hard to where you create either too much muscle activity or tension, then you're not getting the desired, relaxation, change in relative position, or even just like range of motion that you're looking for.
Oh yeah. Well, and kind of bringing it back to, talking about those kids on the field where, like, how can we regress for them? How can we, instead of, we try to use so many words and so many like verbal cues, how can we regress activities so that we don't have to, so that things can be natural? And there's always a regression. There always is. Like how can you, and that's the cool part about therapy and about being a strength coach is, how can you make something work for everybody? What can you think through to challenge that kid to do what you need them to do to be successful? Not just at that very moment, but in the future, whether they're a really good athlete and they're using, they're not, let's just say they're really, really fast, but they don't have good rotation. How can we regress them to be able to gain that proper regression or that proper rotation, or how can we take the kid who's picking flowers in the field, whose parent just wants them to, play sports. How can we get them to also be part of the plan, because you're doing something that is appropriate for them. So yeah.
I'm going to kick it back to you, Rufus. I'm sure you got some follow-ups on that.
I want to know what dialysis is.
What?
Dialysis, whatever that word was.
Diastasis. Oh yeah. Okay, like dialysis is a.
I'm the only guy listening to this podcast probably that doesn't know what that is.
No, that's perfect. Diastasis recti. So you've seen the anatomy pictures where you see like the 6-pack abs and there's that white line down the middle.
Yeah.
Okay, so when you get pregnant, that those abs can split apart, and they do naturally. I mean, they split apart, and that white part it's called the linea alba. It gets spread or it can get torn apart, but it can be spread apart really, really wide. And so you don't really have good contraction. So, women, you might've saw this in Big Mama after she started having kids, her belly kind of tented up when she tried to sit up or do anything. It's like her belly kind of did this little tent thing.
It was 40 years ago. I don't remember.
Oh, you don't remember? Yeah. Well, and you can see it in women now. Like, so if they try to do something like sit up, and they have that diastasis recti, their belly will like kind of protrude like a tent instead of kind of.
Yeah, I know what
Yeah,
you're
yeah,
talking
yeah, yeah. And that's that diastasis recti be like showing itself, showing its ugly face. So yeah.
So how do you get rid of that? Or
All
did
the
we
things I
talk
just
about
said,
that?
Rufus. I just told you.
Of course. There's
Um,
so much information. I have to go back and listen to it. It's like put it all together.
and guys can get, and I've treated guys with diastasis recti. Like, it's not just women, it's anyone who has too much is putting too much pressure, using a pressure system, and putting too much pressure out. They can get that diastasis too. So they have to go back to the basics and figuring out how to actually contract their abs properly, those deep abdominals properly, to start to prevent that leak in the system or that need for extra pressure from the top.
Right.
Kind of like that Valsalva maneuver that people will use if they don't have the proper strength. So then that's why diastases get worse if like women start doing the wrong exercises to get their core back. What will happen is because they're not strong enough for the activity that they're doing, they'll use Valsalva maneuvers that put more pressure out on the abdominal wall and more pressure down onto the pelvic floor. So then you can get more prolapse or more diastasis recti just by trying to fix it in the first place. So
when you're prescribing an ab exercise or coaching it, what are some key points you're looking for, or some cues you may use?
So exhale. So exhale and make sure your belly's going down. So exhale, belly down. Depending on the position, I'll say tuck tail if I know that they can do it. So if they, so it becomes the people who I've already coached that I say, okay, that have the foundations, I just say exhale, tuck tail, because they already know what that means. So, but what do
you mean by tuck tail?
Right. Really, a posterior pelvic tilt, but it can't be a sheer forward, right? And that's what I mean. Like, I've already taught them how to do that, usually by like the wall exercise, or I've propped them into a posterior pelvic tilt on the floor, so they know how to relax their back, because a pelvic tilt or a tail tuck should actually relax your back, and it should relax your abs, right?
So when you get the tilt right, what exactly should that look like? Like, what should you have them in like a hook lying position and you ask them to pelvic tilt, what muscles usually do people feel, and what should that look like in terms of like your ab area?
Well, and I've been working on this a little bit, because for sure they should not have any abdominal activity with it. That's a huge one, because and that's a sheer forward if they're yanking up with their abs. And then what happens is their back contracts too. So what I'll always do is I'll put my hand under their back, but that's not always a sure win, because they'll drive into the ground. And actually, those are the people who a pelvic tilt will hurt their back, because they're just using their back to to force themselves down. Force their back down into the ground. So it goes back to less words. If I find that that's what they're doing, I put if I can't say, like, just tilt your pelvis and let your back relax and your belly relax, if that doesn't work, and it almost never works. If they're seeing me, I don't care what they're seeing me for, it doesn't work. So I give them like either a wedge under their pelvic floor, or towels, because I want them to be able to repeat it at home, right? Like, not everyone has like those awesome wedges. So I'll just put some towels under their back, or like along their pelvis. And depending on the person, I have to do that differently. And then I say, now now relax your back into the ground, just let it relax. And that pelvic, like, it just softens. So essentially it's a yielding strategy. It's not this like major motion that people want it to be. Yeah, I'll have them use like pull their heels back a little bit. So, depending on the person, I might give the cue, feel the inside of your heels on the ground, gently pull back. But really you should be able to be in hook lying and just relax your back down and feel that pelvic floor, or the pelvis just rotate back into a rested posterior pelvic tilt. So that's kind of how I do it. It's not fancy. I don't do anything fancy. I try to, speak to my patients, and that sometimes probably gets me in trouble in, talks like these, but it's what my patients understand and how they do well and how they succeed. But yeah, I'm always looking that they're not using a hip flexor strategy, right? So a lot of them will try to like push their legs away, gets those abs involved and the back involved. So I try to make sure none of that's happening. And then when I get them there, then now they actually have access to, then I'm going to say, exhale, feel your belly drop down as you exhale. And then make sure it doesn't, I said, if your belly starts to push up, that's it. That's all you have. So that's a big thing for me that I use a lot. That's it. That's all you have. I always give the analogy of, if you're running a race and it's a team race and you have to all come in at the same time, do you run as fast as the fastest runner or the slowest runner? So that really gives them an idea that we're working on the bittiest bit, because people want big feels. And so taking away the big feel mentality and saying, you're just going to feel a little bit of abs. I don't want you to feel a lot of abs. They start doing those big exhales. They start contracting their back to posture up, to get more air out. That's all compensatory breathing stuff. And I don't want that here. I want a little bit of deep abdominal, a little bit of TA that they start to feel with that exhale. That's it. And so that's super important because people blow past it all the time. People blow past their abs. They blow past their hamstrings. I mean, they just want more glutes. And so it's all about the baby feels when you're talking about foundational movement. Now, I'm not talking about like performance, right? I work very heavily in wellness, like getting people's bodies functioning again.
And so what is just, again, creating like just enough room or just enough movement? How does that create a yielding strategy in the pelvis, and why is that so important for the people?
Ooh, that's a great question. Ooh, I love that question. Let me think so I can answer it well. Okay. So, when you have, so let's just say it's someone with a hypertonic pelvic floor. Their pelvic floor is really, really tight. And so what happens is if I don't, I make sure, of course, I've set them up really, really well. Let's just say they're in a really supported position and I'm having them do the exhale. So and I'm making sure their belly's going down, that they're getting those deep, the deep abdominal muscles. If they blow past it, what they're doing is they're using their so if they come out of that posterior pelvic tilt, they're starting to use their pelvic floor as a postural muscle, right? So they're trying to support themselves now with what they've been doing, and contracting that pelvic floor and pulling it back to try to manage the system, right? And so I don't let them get to that point, because I'm asking, so if the pelvic floor is yanking back like this and being used as a postural muscle, it's not useful as a diaphragm, right? Just like the diaphragm. Okay. Right. Cause we can, if you have an extension at your like kind of mid spine, right? Your diaphragm is kind of facing out like a clam. It's a postural muscle, right? And it can't be a breathing muscle, right? or it's really, you can't really be doing two things at once, right? Yeah. Or it could cause a strain if you do. Okay. So, what I do is it's the same thing. So as that pelvic floor is pulled back and acting as a postural muscle, it can no longer do the job of kind of contracting up, right? So that's the big thing for them, is being able to take that pelvic floor out of the postural position in a relaxed way and helping them regain the idea of the pelvic floor as a breather, as a pressure manager. Not so managing pressure, not holding my spine and my pelvis back in place. So that's like, that's this kind of stuff that I'm doing. It's that subtle stuff of trying to reestablish proper motion. And there's a time and a place.
How does the posterior rotation create that, or help create that?
The posterior rotation takes, so when you're let's see, I'm not good at like talking this stuff out, like okay, so when you have an anterior pelvic tilt, your pelvis is kind of behind you, right? Your pelvic floor is behind you like this. It's no longer underneath you. And so when it's at this angle, it's not going to be able to grab and pull up as easily, right? So it's no longer acting as a diaphragm. It's pulled up and out and away. So I think that answers your question. So when we get when you get a posterior pelvic tilt, you're walking that diaphragm underneath now. So now it's facing the floor. It's parallel with the floor. Now it can draw up the way it's supposed to, instead of just grabbing and like just being hyperactive or tonically active back. It's like, I mean, and it goes like, when you think about the neck, it's like the neck forward. Sorry to just move my phone around like that. When your neck is forward again, like you're just grabbing, right? And just trying to hold on for dear life. And instead of being able to move functionally with movement and do its job while other muscles get to do theirs.
So it's kind of like based on the orientation of the way the pelvis is facing, it's not going to be an efficient mechanism to pump things up and down as you breathe.
You got it. And it's all the pressure system, right?
Mm-hmm.
And motion inside. Yeah. So it all comes around. And knowing and working with the pelvic floor, it was really fun to go to the intensive after doing all this pelvic floor work for so many years and being away from. It was funny because like I told Bill, I was like, before I went to the intensive, a lot of the stuff that I did PRI with Bill. And so that's what he was, and as I was treating people, I realized how many, just realized the deficits in that system. And I'm like, there's just a lot here that's just not lining up. It's just not, it's just not what, it's not matching up with what I'm doing and seeing. And it's been really neat to then go back to the intensive and Bill and I talking and being like, oh yeah, that's exactly it. That's what I've been seeing. This is what I've been doing. And it be, just right on the money, us kind of seeing and doing some different things and then learning even more has been really cool.
Keep going.
Oh yeah.
I want to pass it off to you, Rufus, if you have any more questions about
I
the kids.
don't have any more questions that would fit into this conversation.
The kids need it too. Kids need their pelvic floor. When you have those kids that are kicked out, the kids that you see that are bad movers, they're usually bad standers too.
Yeah, right. I've noticed that.
Yeah. And so those are kids that you need that system, you need the lining up of their pelvic floor and their diaphragm. And so that's when you get them into those really supported positions. Like I said, end with some breathing, have them hold their knees up to their chest, have them in child's pose, and just have them breathe, not think about anything. And you start to just reestablish that good movement in the system.
What's you keep referring to, what's child pose?
Oh,
That's one, I've never heard of that yet.
Corey, can you help me with that? I have no way. Well, I mean, maybe
Corey's getting really
throw
good
up
at
a
speaking
picture.
Rufus. Yeah.
Yes, but essentially you're on the ground at first on hands and knees, and then you just kind of sit back on your heels and have your, elbows kind of near you, and you can even put your head on the ground a little
Okay.
bit. It's like I always tell kids, like, be a rock.
Yeah.
Be a rock.
Okay.
And then happy
Rufus,
baby is
Happy baby.
Like the bear position you put people in sometimes.
Right. Yeah.
It's basically like that, but you just drop them down to their forearms and have them rock back to where their butt's basically getting closer to their heels.
Okay, I got you.
And if they can't get their butt towards their heels, stick a pillow there, stick something there so they can feel it, right? Because that's what they need to feel. They need a stop, like to feel a stop. So if you support them, they'll be able to yield. But if you don't, then it's random. It's just a random thing that they're doing. You've got to help people yield and relax. But if their butt's in midair, then they're not able to like really relax into something.
So I get a lot of that. We put them in just a bear.
Yeah.
Just on their hands and knees or whatever, and they got their butts sticking up in the air. And I always tell them, I see you guys make great targets. I'm bring my AR-15 in and shoot at you.
Yeah.
The bullseye's right there.
So I wonder if you did that, if you did some of the child's pose breathing first, and if you see that a kid can't get back onto his heels, shove like a phone, like a yoga mat or a pillow between their butt and their thighs, and let them take some breaths and relax, then go ahead and do the bear crawls and see if it gets them down a little lower, because you're relaxing their pelvic floor and teach them to yield back a little bit.
Right. I got a question I'll ask you off camera, but
yes, love those questions.
Why is having the implement to create a stop so important? And can you apply the same thing to like a squat? Just now you're upright.
Yeah. So, it's the difference between sitting on the couch and doing a wall squat, right? Which one are you more relaxed on, in sitting on the couch or doing a wall squat?
Sitting on the couch.
Right? So you're providing a surface, or you're providing a surface or something for them to feel, for them to relax their muscles. If they're in midair and they're already struggling, right, they're not going to be able to feel themselves be able to relax down into something. They're being held up. So the reason that they can't get back into a full child's pose is already because of compensation somewhere else, right? So if they're stuck up like this, it's because they're compensating somewhere and they can't let go, right? So they're already they're feeling that postural, they're using that pelvic floor as that postural muscle to feel like they can just to hold position. So you shove a pillow in there and so that they have something to relax back into. And now in their range of motion. So now they can release their pelvic floor as the postural muscle and be able to breathe into their pelvic floor and yield it. So that's why it's so important to give them, if they can't get if they can't get all the way back there in that yielded position, you always want to support, always. So if in doubt, support. That's what they're looking for. That's what their bodies need, because then their body will do it naturally. Okay. So well, good. So then taking it to a squat, the same thing applies. And I do this all the time. Like, if someone cannot squat all the way down, I'm always, giving them a higher surface. Like, how can this look good at a higher surface, or a higher level, and allow them to really build, instead of just using compensatory strategies to get all the way down. How can we start up higher and help their body feel what it's supposed to do properly, right? Feel themselves get on into their heels. If something's too hard, you will always use a bad strategy. If something's too hard, you will always use a bad strategy. You have no other choice. So, if we raise the surface and help them if it's appropriate, help them find the surface, breathe, allow their pelvic floor to yield, and then be able to come up out of the squat. But again, if it's too low, that's the whole thing, like you might shout from the rooftop, let's just, is it, like a box squat's really great for someone with a hypertonic pelvic floor, right? You could shout that from the rooftops, but if the box is too low, you've already lost, because they're already compensating on the way down. By the time that they get to the box, they're going to have hip flexor pain because they've already had to compensate. So start them out at a level before any kind of compensation happens, right? That's where you win. That's where they're feeling what their system is doing. And there's this aha moment of like, oh, this is like, I'm working. This is what I always love to hear. I'm working, but it doesn't feel hard. Like I'm feeling my muscles, but it doesn't feel too hard. Like they don't have to use momentum to get out of the position. And that's what they're talking about. Like they don't have to like herky jerky themselves out of the position, which is uncomfortable. And, it's way too difficult. So.
And this is more on like the wellness side of training.
Okay. I'm glad. Good. Yes.
Just because, I mean, one thing I struggle with just from a coaching standpoint is it's always like, how much do you want to coach them to where it's too much cueing, or it's too much coaching to where it's probably the wrong exercise choice.
Oh yeah.
And there's always that like, wellness versus performance spectrum you're operating on, like how much of the eye test do I want this to pass?
Right.
So like with your kind of population, are you leaning more toward the wellness side because you have to be more precise with the exercise selection and the setup?
Yes, absolutely. They have lost everything. So like, if you can do performance if you have some base of stability in your system, and that's great. Like performance is awesome if you have like the stability to be able to manage it. These people, their abs are blown open, their uterus or their bladders falling out of their pelvic floor. Like this isn't or they're having pelvic pain. Like this is all wellness. This is all like, how do I put you back together? How do I teach your body how to function, even for walking, or just to be able to do an exercise program to get your heart rate high enough to just work into that, the basic, like cardio prescription, that's the stuff I do. So if it's not perfect, then it's not going to happen. I'm not going to give it to them. If it doesn't, and that's why I've had to learn to regress so much and so well, because I have to send them home with this. So I can't use a bunch of cues. I have to be able to give them I have to teach them and to be able to do this really well on their own. Otherwise it all falls apart, because it's not about anymore like being able to lift more weight. It's about like lifting like a 6 like or a 12 pack of soda off the ground without peeing on themselves, or without causing their prolapse that got fixed by the surgeon from happening again, for them having to get another prolapse like a or like a bladder tack, which you can't do a million times. So if I'm not teaching them exactly how to do this, they're going to carry over bad habits to real life. And that's where you get in trouble. That's where like someone comes back for they're seeing me. They're seeing me after their second bladder tack, and the surgeon's like, you can't have this again. We can't do this again. So you can't mess this up. One really good example of that is I've been working for like 7 months now, because with a military officer. She it was her second fix. Like I think she had a rectocele, and they fixed that twice, and they were like, we can't fix this again. However, like the military, I don't know if you know this, but like the military guidelines of like the what you need to pass like their um whatever their athletic performance stuff just started, it changed, and they have to be able to do a 140-pound like trap bar deadlift. And she was like, I don't know what to do, you know. So she comes to me, and we've been slowly working on building her strength only using these strategies. She's not allowed to hold her breath, so I have to get her crazy strong because she cannot use a Valsalva because she will ruin the surgery. So we have been doing baby steps. We had to start with all foundational skills, and of course, you know, there's a 1-2 punch. She had this crazy, like, I can't remember what it was for, but there's a vertical abdominal scar from, I think it was like an emergency C-section where they had to go vertical. So she didn't have any abs. Like she was really like, she could do all these exercises. She'd tell me what she was doing. I was, you know, so she had a lot of like superficial abdominal muscles, but she was never even using at all her deep abdominal. She didn't even know how. She used, you know, and so we had to scoot back. We had to get the pelvic floor right. We have to get the abs right. And we had to work really slowly. And so she was only allowed, and then, you know, we had to do a lot of pelvic floor yielding strategies so we did a lot of hip hinge stuff, or like the Campo deadlift stuff to get her to feel how she needed to like essentially yield in her pelvic floor to load her glutes and her hamstrings, because she was only using her quads. So it's stuff like that. And so it's not just wellness in the sense of only doing like basic activities. It's like, okay, you have to do this high performance activity, but I have to teach you how to do it with wellness strategies. It can't be about being the best.
Yeah, I think that's a great point, because you never want to create more barriers than necessary, but in some cases you're going to have to create some constraints or be a little more like coaching or cueing focus. Otherwise you're going to have a flare up or things are not going to go well. So you're always kind of fighting that battle with who you're working with.
Oh, absolutely. Absolutely. And like I said, I just have to get them well enough. Usually I just have to get them well enough to work with a good coach. Usually that's, you know, like to be able to have a little wiggle room where if they did something wrong, it's not going to kill them. Or if they do something, you know, like you said, to use more performance strategies, that it's not going to tear their bodies apart, but they need at least enough foundation to be able to have that wiggle room.
Mm-hmm. Yeah. I think that's why it's also so important, like what Rufus does, where you develop such a good coaching eye to where you can coach things and make things look good. So you don't have to regress back to your like lower level wellness stuff, and you can build up the performance stuff
that's exactly it. And that's what I always tell my patients. I tell them right away, I'm like, I hate to go backwards. I hate it. I hate taking 2 steps back. So I'm like, I'm gonna, you know, and it helps them know, it puts a little bit on me too, instead of on them, where I'm like, you know, where it's like, oh, this is too easy. You know, I just say, I hate to go backwards. So I'm, you know, we're going to take things super, super slow. Just because I just don't like it. But it gives them the mindset of, okay, like you said with Rufus, like you don't want to have to go backwards. You do it right from the beginning, and you know, meet them where they're at with a good set of eyes.
You guys have made me feel like the world's worst coach. You know that, don't you? Because I don't know any of this stuff. I got no idea.
That's the point. Like, that's the point. You don't have to. And I mean, I'm the, you know, like when I talk to my patients, you would think I, you know, had a 5th grade education. Like you don't have, it's all about eyes, right, Rufus? I mean, like you can spot something across the room, and it's just about being able to have eyes and give them that one little cue that helps them like fix it up, or give them an exercise that you know that they can do that will make what they're going to do next better. That's it. It's not about all the smart words.
But that was great. You got anything else, Corey? I think my brain's fried for the rest of the day. I don't know if I can do anything but watch NCIS reruns or something.
I have more stuff, but I don't think I'm mentally prepared to to go there today.
Probably me either.
We got to do this again.
I'm all about it. This was fun. I had fun. I didn't even know what I was going to talk about. I was like, well, I hope I don't sound like an idiot.
Neither did we. we just start the conversation, and so it's like when you sit in a room and somebody asks a question and it goes from there, right?
Yes, so that's awesome.
He doesn't today, but Corey used to have this long list of questions he would prepare, and he'd say, "You got your questions?" No, I'm just gonna, ask questions as the topic comes up and stuff. And so this was fun. How can people get in contact with you? Go to your clinic, or I know you're in Lexington, right?
Yeah, I'm in Lexington. And I work at Bauman Physical Therapy. I do some stuff, like I said, on the side. If that's, I even do some stuff like some Zoom stuff. And so either my you can like my Instagram's what is my Instagram name? I have an Instagram name. I'm the worst.
Corey will find
me out. I have an email and or like Facebook Messenger, all those things. Yeah.
What's your email?
S as in Sarah, B as in boy, MART, the number 2 @gmail.com. And then, like I said, Instagram Messenger for this kind of stuff is great. You can follow me on Instagram. I put some stuff up here very rarely, but
cool.
But there are some videos up there.
And I know you post stuff to Facebook a lot. Especially kids. I love the ones the kids. And so everybody knows I'm kidding her about her kids being dirty all the time. And I know she gives them a bath at least once a week and on Saturday night or something.
Yeah. When they
whether they need it or not.
Yeah. Well, I posted some soccer. So I've been posting, the Benji soccer thing, because that's hilarious to me. And I would have never put that kid in soccer, but because I'm, you wait for a few years, but he was so into it. He was insane. And he listens. He's my kid. He doesn't listen to anything. He's always like, he would jump off the roof if he had the chance, he's already figured out the deadbolts and stuff. But at these soccer practices, this kid is like all ears. He listens to everything they tell him, because I do like how they do it. They do like 40 minutes of like little skill building, and they start out, stuff that they can do. And then they end with the game. The game's the stupidest part. It's ridiculous, but it's funny and it makes for good videos. But then I got some videos of Eliza from this week, and that girl, man, she's gonna be a defensive master. There's a video, and she just hip checks this little kid. He goes flying.
That's her mother's rugby coming out.
Oh yeah, that's exactly what it is. Like, move it. Yeah. So. Yes. So we're having some fun.
That's great. Well, I enjoyed this. No, we got to do this again, because I got more questions. Yes. And I know now that Corey's had a long talk with you, he'll have more questions. We may have to do one with just you and Corey, and just you and me is the way we'll have to do it, probably.
Oh yeah, they'd be completely different. That would be kind of fun.
Yeah.
Well,